Welcome back to Channel 5 with our special guest, Dr. Steinberg.
Thanks for having me tonight, John. I'm so glad to be here this evening.
Of course. So we're bringing you on tonight to talk about someone like yourself, reconstructive surgeon. Well, how many years of training did it take to get to where you are today?
Well, the education was long and difficult, yet I loved my journey every step of the way. I spent the first 4 years getting an undergraduate degree in chemistry, while others out there got theirs in biology. I then continued to take out more student loans and begin med school so I could earn my MD, or Doctor of Medicine. This required 4 more years of college, with which the first 2 years were between the classroom and the laboratory. The second 2 years is where I obtained my clinical experience in the doctor's office.
That's quite a lot of time. What do you do after receiving your MD?
Well, John, I attended medical residency training for 5 to 6 years. The first 3 years were in general surgery, and the last 2 to 3 years were a specialized field of surgery. I then passed the final test and became a licensed surgeon. I then chose a fellowship or a subfield in reconstructive surgery, thus taking 13 total years of training.
Wow, that's a lot. After you've done all that hard work and training, what are some of the things you do on a regular basis?
Well, John, we do a lot, but to narrow it down, I can give you some main ones that we see most often in the medical field. First off, we do a lot of breast reconstructive surgery, which for some plastic surgeons means adding implants, while for others it means removing breast tissue to prevent tumors from forming and thus breast cancer.
So reconstructive surgery can be both cosmetic and medical?
Of course. Well, we help people who merely want to improve their appearances, but also those who suffer from congenital birth defects or sustain major injuries. Thus, we often do many surgeries on the hand to fix problems such as carpal tunnel syndrome or arthritis by removing dead tissue, rearranging joints and bones, and sometimes replacing them altogether.
I understand now why someone with this profession would need so much training.
Very much so, but that's not all we do. We often do scar revision therapy, where we conceal scars from trauma, injury, or birth to blend in better with skin. This involves doing advanced technique in wound closure. To wrap it up for you, John, the final thing I will say is that we often do lymphedema therapy, where we remove healthy lymph nodes and place them in areas with diseased ones to help that particular area come back to health.
Sounds like a really stressful job. I hope it's rewarding.
Well, the reward for me is helping others. However, if you're referring to salary, reconstructive surgeons do make a substantial amount of money.
How much? I mean, you're doing a lot of stuff there.
You would be correct. Reconstructive surgeons make around $360,000 to $450,000 on average per year. However, individuals who have set up a certain subfield practice of reconstructive surgery can make more than others. For example, a neurological surgeon can make $573,000 a year, while a burn reconstructive surgeon makes $406,000 on average.
Are there other fields within that field that make more money then?
Yes. A trauma reconstructive surgeon can make $381,000 on average, and a pediatric surgeon can make $422,000 on average per year. Overall, reconstructive surgery provides a substantial paycheck for the real cause. Well, the real cause is to help others recover and feel better about themselves.
Well, Dr. Steinberg, we thank you for your time, and I hope to see you again soon.
Thank you so much for having me tonight, John. Thank you, everyone.